I see patients who have dementia, may have Alzheimer's disease, that question is what the family always asks. What can we do, and what's important? Physical is number one, social and intellectual is number two. Physical is actually number one, believe it or not.
Well, why? Why is...
I don't know why that is, because I have a hard time I just know what the studies say.
Thanks for watching, my friends. This is a special episode on Alzheimer's and dementia and the things you could do to keep your brain healthy over time.
One of my questions I wrote down was, some people may come in with conditions of the brain that are kind of undiagnosable, right?
Right, how do you know that?
I study things.
You've had a few yourself.
I had a few mental disorders myself. But, kind of speaking on the mental health topic, some people may come in and not know what's kind of going on with them. Or it may not even be a disorder that's even invented or found yet, right? It's just kind of things they're doing in their daily life that's like affecting their mind, their state of mind. What do you see the things that people are doing like that are just not healthy for them? Is there anything like that?
Yeah, I think that we're kind of now getting into the realm of neurology and psychiatry, and they're not the same, but they're similar. But for all mental health, physical activity on a daily basis for all neurologic health is important. Social activity, being around people that love you and that you love, is important.
Very.
Right? And intellectual activity, cards, board games, whatever, crossword puzzles, whatever it is that you enjoy in particular. There isn't a game that's the best, but if there is something that you're enjoying, reading, they say writing. I know you're a writer. I think they say writing is the highest level of intellectual activity that you can actually perform. Really? Yeah. So when I see patients who have dementia, may have Alzheimer's disease, that question is what the family always asks. What can we do, and what's important? Physical is number one, social and intellectual is number two. Physical is actually number one, believe it or not.
Well, why? Why is...
I don't know why that is, because I have a hard time I just know what the studies say. But why that is, I don't feel like I know that answer. But it's true. Patients usually come with families, especially if there's a neurologic disorder of any substance. And families come in this order. Daughter, almost always.
What do you mean? So
this is the hierarchy of who shows up with
the patient.
Right. So, and if it's an older patient, number one is daughter. Number two is daughter-in-law.
Wow.
Number three is son. There's a thing to being a woman and being a caregiver, and that's real. And so I see that in my office, and I talk to other doctors, it's the same thing. But when they're there, they want to know, how can I help? How can we help? What can we do? And sometimes there's medicine that's helpful, and there's testing that needs to be done. But we always talk about physical, social, intellectual activity. And they're on it for the most part. Yeah. The patient is like, oh God, I got it.
Yeah.
But it's, and I don't, if you just want to talk about Alzheimer's disease, I know that there are no drugs that will slow down the rate at which Alzheimer's progresses. I know that. Not just me, but the whole world. There are a few drugs that could maybe help day-to-day memory in an Alzheimer's patient. In general, on average, they work poorly and they have side effects.
Right, and Alzheimer's is just like essentially the eating away of the brain?
Alzheimer's is the most common cause of dementia in the United States. So if you just take 10,000 people with dementia, over 500 of them will have Alzheimer's disease, it's a specific disorder. The body is making extra proteins in the form of plaques and tangles and they're crushing the nerve cells slowly.
Which store your memories.
Exactly.
And your cognitive abilities, right?
So forgetfulness is the most common symptom. Language problems, trouble coming up with words.
And what areas of the brain does that mostly affect? Does that
the
affect?
hippocampus and the temporal lobes of the brain, which are like inside of where your ears are, about 2 inches.
Yeah.
But it also affects frontal lobes, and over time, it's the whole brain that gets affected over time. Alzheimer's runs in the family. So do I. My mother had Alzheimer's when she died. 2 of her brothers died of Alzheimer's, and her sister, who's alive, has it. So my generation will be the first generation probably that will be on a medicine to treat Alzheimer's.
Wow.
Thanks for watching my video, my friends. You can subscribe to my channel by clicking the icon here or watch one of my newest videos. Thanks, my friends. See you next time.